Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician, and today I'm reacting to Kevin Durant's injury in Game 5 of the 2019 NBA Finals. Previously, Durant had injured himself on May 8th of the Western Conference semifinals. He apparently suffered a calf strain of his right calf. And even as late as a few days ago, there had still been speculation as to whether Kevin Durant would be able to return for Game 5 or Game 6 of the series. Fortunately, Kevin was able to return for Game 5, and certainly that was able to light a fire for the Warriors in the first quarter of the game. However, that all went to pot in the second quarter. During the second quarter of the game, we can see here that Kevin Durant has the ball, and he pushes off of his right leg as he is driving to the hoop. Immediately after making his initial move, he kind of stumbles. He turns to walk off the court as he knows that something is wrong. In the slow motion film, we can see that there is a shockwave that originates in the area of his Achilles, which then reverberates up his leg approximately through his calf to his lower thigh. Now, if we think about the anatomy for a second, this is the exact distribution of the Achilles and the gastrocnemius. The Achilles tendon inserts on the calcaneus at the upper aspect of the heel. It attaches to the gastrocnemius and the soleus more proximally up the back of the leg. And if you look at this reverberation, you can see that it travels this entire distance, starting distally or down low at the level of the Achilles and then traveling upwards to the back of the thigh. So what does it actually mean when we see this shockwave travel up the leg? If you speak to patients who have torn their Achilles, one of the common ways in which they'll describe that moment when they tore their Achilles is that they'll say that they were either shot in the back of the leg or they were struck in the back of the leg with an opponent's hockey stick or bat or tennis racket or whatever. And it's important to note that when the Achilles ruptures in these patients, they're not actually being struck by anything. However, the Achilles is under such high tension that when it actually snaps, it feels like they're being shot. So at this point, they have said that he has suffered some kind of Achilles injury, but I am telling you that this is an Achilles tendon tear of a high-grade nature until proven otherwise. The reason why I say that it is a high grade and not a complete tear of the Achilles is because we can see that at some point he is actively moving his ankle up and down. And generally speaking, if you had a complete tear of the Achilles tendon, you would not have active plantar flexion of your ankle. But after watching this video, I am quite confident in saying that this is a high-grade tear. And by high grade, I mean more than 50% of the fibers. The reason why I'm saying this is because you can see the bulk of fibers retract up the lower leg as he pushes off in the slow motion film. Now, because I haven't performed an actual physical examination of Kevin Durant, I can't tell you exactly at what level he has injured his Achilles. Nor can I tell you whether there is a significant gap in the Achilles tendon. However, after reviewing this film, I would venture to guess that he has a palpable gap, in other words, a space in the Achilles tendon in the back of his leg, and I would venture to guess that this injury has occurred either in the Achilles tendon itself or at the musculotendinous junction. And by that, I mean where the tendon attaches to the muscle. Now, does that even matter? Well, to know whether this is significant or not, there's a few things that we need to consider. First of all, if we're assuming that this is actually a rupture of the Achilles tendon, we have to decide how we're going to treat this. We can treat this non-operatively by cast immobilization, or we can treat this operatively by an actual Achilles tendon repair. And the Achilles tendon repair can be done by an open technique or by a percutaneous technique. The decision of whether or not to treat Achilles tendons operatively or non-operatively has been a subject of debate for many years. A comprehensive review by Lowe and Kirkley et al. Has demonstrated that the results of operative treatment versus non-operative treatment are largely equivalent. This is to say that the long-term results of both methods of treatment were acceptable and equivalent. However, in the short to intermediate term, tears that were treated non-operatively had a 4 times higher re-rupture rate than did tears that were treated operatively. This is 12% versus 2.8% respectively. But it's important to note that tears that were treated operatively had a significantly higher rate of complications, both minor and major, than did tears that were treated non-operatively. Therefore, the recommendations from this study were that the treatment of Achilles tendon injuries should be specifically suited to the needs of the patient and their overall health condition. Now, this is a perfect opportunity for me to talk about the location of the tear. Now, as I mentioned before, it's difficult for me to tell from this video where the tear occurred. If it occurred at the insertion of the Achilles, mid-substance in the Achilles, or at the musculotendinous junction. But why should that even matter? Well, the reason why that matters is this. When you consider the consistency of the Achilles tendon material, it's kind of like a leather strap. The gastroc and the soleus, on the other hand, are kind of like steak. When you're considering repairing the Achilles rupture, if you consider sewing back pieces of a strap together, you can visualize that each of the sutures that you place in the Achilles tendon material will be able to get good purchase. So if the tear occurs in the mid-substance of the Achilles, you'll be able to get secure fixation both on top and bottom in order to get a good and robust repair. If the rupture occurred at the insertion of the Achilles on the calcaneus, even better. You'll be able to decorticate the bone on the calcaneus at the insertion of the Achilles. And this just means we're going to be able to scrape the outer coating of the bone off. And then, using anchors, which are kind of like screws with thread attached, we'll be able to secure the Achilles directly to the bone at the calcaneus. And bone tendon fixation is going to be stronger and more robust than tendon to tendon fixation. However, if the tear occurred at the musculotendinous junction, that's a problem. Remember I said that the gastroc and the soleus are kind of like steak. And you can imagine that if you tried to sew steak together, it probably wouldn't work out too well. So, if you're trying to suture the tendon back to the muscle at the musculotendinous junction, you're kind of SOL without a paddle. If he was unfortunate enough to have suffered an injury at the musculotendinous junction, this is something that will be treated non-operatively with the hopes that it will scar down, and then after rehabilitation, he will be able to regain the contractile ability of the gastrosoleus Achilles complex. Obviously, this is not as favorable as primary healing or as a primary repair, but in that situation, it's the best that they can hope for. So I'm hoping for Kevin Durant's sake that this is an injury that occurred either at the Achilles insertion or in the mid-substance of the tendon. But one way or the other, we'll find out after they've done the MRI, which they'll probably have done by the time this video comes out, so you can check that for yourself on social media. Despite the method of treatment, the overall recovery time is going to be similar. First, it's going to take approximately 6 weeks for the Achilles tendon to heal, whichever way they treat it. And during this time, the foot will be maintained in a position of plantar flexion. That means with the toes down towards the ground. Typically, this will be done with a fiberglass cast in a plantar flexed position or with an air cast with heel wedges. After 6 weeks' time, when healing has occurred, the foot will be gradually returned from a plantigrade position to a neutrally flexed position. In other words, with the foot flat and the foot and the ankle at a 90-degree angle to the leg. The reason why they put it in a plantar flex position to begin with is because they want to keep the two ends of the tendon as close together as possible to maximize their opportunity to heal without any kind of extrinsic or external tension on the repair or the healing process. Once the ankle is able to be placed in a neutrally flexed position, then physical therapy can start. The goals of physiotherapy include restoring a normal range of motion, both plantar flexion and dorsiflexion of the ankle, and then restoring full contractile strength of the gastrosoleus Achilles complex. Someone reached out to me on Twitter and asked this. Also, why was Durant icing mid-game? That's a recipe for disaster. Cold tissue does not have the elasticity of warm tissue. At HumanVerse2. To which I responded, most definitely it does not. I suspect they were desperately trying to deal with whatever inflammation was occurring and using it as an analgesic modality. I don't think that they appreciated the degree of damage that was lurking below. Hindsight is 20/20. So during the game, you certainly wouldn't want to ice it if you were suspicious that there might be pre-rupture-like damage to the Achilles tendon for exactly those reasons. Once you cool down the muscles, its ability to contract is going to be decreased. It will actually become tighter and less elastic, making it more prone to rupture. But in all honesty, I don't think that they suspected that that level of damage was in fact present. And a lot of people are asking, well, why would you have Kevin Durant even return at this time if you thought that there might be a risk that he would rupture his Achilles? It was an opportunity for the Raptors to close the series and win the NBA Finals. I think that there was probably a lot of pressure on Kevin Durant to return to their team to try to help them to progress through the finals. But certainly, injuries like this occur in tissue that is typically tendinotic. And what I mean by that is tissues that have seen chronic inflammation. So it is likely that Kevin Durant had been experiencing symptoms in his Achilles for some time, and the calf strain that he suffered earlier was probably just the tip of the iceberg. Either way, it doesn't matter because it's happened, and I'm wishing him the best of luck in his recovery, and I hope to see him back on the court next year doing what he does at the best of his ability. So that's it for today, and as always, that's been a word from Dr. Chris, not your everyday ortho.
There's the play right away. He knew it.
Warriors without Kevin Durant. Once Warriors without Kevin Durant. Once